Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Hey, what is animal chiropractic? Animal chiropractic isn't veterinary medicine. It's not chiropractic. It's not body work. It is similar to veterinary medicine. It is similar to body work. It is similar to chiropractic. But it's not any of those. It is a separate entity. Animal chiropractic isn't about moving bones. Animal chiropractic isn't about curing lameness. Animal chiropractic does those things. It's not about relaxing muscles. It's not about, improving gait. Animal chiropractic does those things. Animal chiropractic is the identification and removal of vertebral subluxations that create nervous system interference. This nervous system interference causes the body to not function at 100%. If the body's not functioning at 100%, it can't counterbalance. It can't correct itself when it's falling. It can't digest its food properly. It can't respond to thunder in an appropriate manner. All kinds of things that go on. So, an appropriately trained animal chiropractor isn't going to do muscle relaxation. That's not the goal. It may be a side effect. It's not going to improve the gait. Might be a side effect. Better digestion, side effect. Calmer horse, calmer dog, side effects. All those things might be side effects because all the certified animal chiropractor is trying to do is remove the vertebral interferences to the nervous system to restore nerve flow to 100% so that then the things around can happen. I had a gentleman this weekend talk to me about how if you had, one contractor come in and fix a cracked pipe and another one come in and reseal the caulk around a window and then 6 months later a different pipe cracks and another window is needs recaulked and how that you can just go on and on and on. But if you go in and really look at what's causing those pipes to crack, what's causing the caulk around the windows to start to fall out, maybe it's the foundation. And so when somebody goes in there and corrects the foundation, then the windows stay caulked, the pipes don't crack anymore. The doors swing freer because the problem wasn't the caulk, the door that was sticking, or the cracked pipe. The problem was the foundation. And it's the same with animal chiropractic. The problem isn't the bilateral muscle asymmetry. It's not the lack of digestion. It's not the lameness. The problem is the interferences in the nervous system. The problem is the foundation of every function in your animal's body is related to its nervous system. When you have a certified animal chiropractor come out, look at your animal, they're going to look at things like that. They're going to know which side of the nervous system is having problems. They're going to know where the nervous system is being interfered with. It may be a long ways from the problem. It may be right close to the problem. But when they remove that interference, your animal's going to feel better. It might last a day or two the first time. That's okay. Because then the second time, it should last 4 or 5. And eventually get up where, depending on what you're doing with your animal, it's lasting an appropriate amount of time. The animal's able to hold his adjustment. Yep, our goal is to get your animal addicted to chiropractic care. To get your animal addicted to feeling the best he can be, the best she can be. To get your animal addicted to feeling great. To being the best companion it can be for you. Whether that be a lap dog or a champion dog. Whether that be a pasture ornament or a 1D barrel race. So, remember, the body heals only one way: above, down, inside out. Keep your animals adjusted. Have a great day.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is Animal Chiropractic is our sole mission at All Creatures Every Spine. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to provide the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome. We all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the #1 hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. Amy and Dr. O sent you. You'll be glad.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hey everybody, welcome to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O, and I'm here with Dr. Grover. Can you introduce yourself and tell us a little bit about yourself?
Hi, I'm Dr. Alisa Grover. I go by Dr. Allie here in Utah, and I have been practicing in the state of Utah for about 8 years now. I just recently opened my own practice, Head to Tail Animal Chiropractic. Prior to that, I worked in and out of various veterinary clinics, and I was fortunate enough to be one of Dr. Ormston's students back at Parker University Animal Chiropractic program in 2012.
All right. So you were one of my last students, actually.
Before you started ACEs.
Yeah, then we started ACEs.
Yeah.
But let's talk a little bit before we get into this too far. So you went into a state, because we get these calls all the time. Oh, what state should I go in? What state is best? You went into a state where actually it wasn't really easy to start practice, was it?
There were definitely some hoops to jump through here in Utah. The requirements at the time that I moved here were that you have an ABCA approved course or similar. And it interestingly didn't actually require the certification, but you just had to have completed the course. But then you had to have a veterinary referral to work on an animal. And that was one reason why I chose to partner myself at veterinary clinics, so that when those times would happen that somebody would want an appointment and maybe not have a good relationship with their vet, or not have a vet, or not have a referral, have a difficult time getting a referral, I already had colleagues there that we could say, hey, do you mind checking out this animal, making sure that it seems appropriate to do chiropractic on them. And that worked out really well. I still got turned in times. And so I had to do the whole, respond to DOPL and show them my Department of Public Licensing and show them my referrals and that I was dotting my I's and crossing my T's. But it worked. It was fine. And I actually feel like because of that experience of working at the vet offices, I learned so much more than I actually would have if I would have just gone out and practiced on my own. So I am really grateful for those 8 years that I spent, 7.5 years, whatever it was, working side by side with the vet clinics, seeing all these unusual cases come in, having them refer to me referring back to them, being able to see the follow-up of various things. Sometimes you have concerns about a patient and you might send them off and never really hear what came of it. But being at the vet clinic allowed me to be really right there in the thick of it all. And I really did like it. And the main reason that I decided to leave, besides the change in law, which I'm sure we'll talk about in a moment, was because of COVID. And I was getting so tired of the curbside drop-off routine. And I was absolutely delighted to be able to open up my own office where people could come in again with their pet. And I didn't need to be trying to adjust them and hold them at the same time, hold and adjust, or try to grab a vet tech that was available, and vet techs are never available. So that was it. But I loved working with the vets. I still keep a really good relationship with all of them. We text back and forth. I'll be like, hey, I got this crazy case today. What do you think? I'm sending them patients all the time and vice versa. We've kept a really good relationship.
Good. But I really think I like that, that you found that it worked well to do in the.
It did. I would actually, and I wouldn't have thought of this until you really brought it up, but if there was a new student or a new graduate, I guess I should say, going out into the work world, trying to determine what to do or how to set up their practice, I actually would recommend looking into seeing if there's any vet offices that would want to bring them on. Not necessarily full time. If you want to do your own thing, great. but maybe see if there's an office that would like to have you come in one morning or one afternoon a week so that you could work on some of their patients, and then you can kind of get some of that experience too. It was really good cross training.
Good. So even though you were following the law, you still had problems with the board. I know we have too. You know, I mean, I've been turned in, Dr. Amy's been turned in, you know.
We have a rite of passage for animal chiropractors, I think.
Yeah, I agree. So, you know, and it's, but it's always about record keeping. It's not about, you know, hurting an animal or anything like that.
It's about the record keeping.
Yep. Are you dotting your I's and crossing your T's? So I think, and also, you know, we've had some people, I don't know what the definition of animal chiropractic is. In Utah, we'll talk about that in a minute. But in North Carolina, it's adjusting, not cold laser, nutrition advice, or any of that stuff.
Mm-hmm.
And so in North Carolina, as long as animal chiropractors adjust and don't use any other modalities, they're fine. But if they use other modalities, then they've crossed that line. That's where they get in trouble. So I think we do, the dotting the I's and crossing the T's has to go both ways. We have to know what the law is in our state so that we can then dot our I's and cross our T's appropriately.
Absolutely.
Yeah. So tell us about the new law. And it's got to be exciting.
It's so exciting. I feel really blessed to be in a state that has passed this law, because it's actually not very common here in the USA. The governor signed on a new law which has made it so that those who are certified with the ABCA, if you are a chiropractic physician licensed in the state of Utah and you have your ABCA certification, you can see animal patients without a veterinary referral. And I love the fact that they require that ABCA certification, because I think that the ABCA does a really good job of examining and certifying, you know, their members, and the courses that are ABCA compatible or ABCA certifiable do a really good job of teaching as well. So that's how it currently is set up. And once that law went into effect, it was immediate, and I haven't run into any issues, you know, since that. And there doesn't seem to be a whole lot of contention about it. Ironically, when the law went into effect at the time, it really only affected myself and I believe maybe one other animal chiropractor in the state, who I actually don't even know who he is. He's not listed on the referral website, and nobody can tell me his name because he has not allowed to disclose it for referral reasons. But I've just heard through the grapevine that there is another ABCA chiropractic physician in Utah. And then after that, there was also a gentleman who sat the exam in February. And I haven't heard if he got his results back yet, but I know he was awaiting his results to be official. So there's a small handful of us.
Right.
We weren't really the ones who lobbied for this. The guy that just sat his exam said he did write a letter to the Senate and just said, hey, you should look into this. I did find out that last year, the massage therapist just passed the same thing for animal massage therapy. And I'm not sure how that one was brought about or lobbied, but they just changed that so that if they are certified, if they have had the education and the certification, they don't need a referral to do animal massage. And then this year they did the chiropractic. And then I'm not sure where it's going to go from there with like physical therapy and things like that. But.
Well, I know the gentleman that wrote the letter in February. He got the ball going. Or he wrote it back in back in like October last year. It was Dr. Nate Martin.
Yeah, he's the one from that I knew about from Tooele. So it was a letter, you know, and it makes me think, well, why didn't I write a letter sooner? And I think that, you know, after watching this happen in other states and like in Colorado, you know, there were hundreds of chiropractors pushing for this, and the clients had to write letters, and they were lobbying, and there was all, you know, every state, it seems like such a battle. And I thought, why go through this battle? I'm one person. I'm the only one in the entire state that this even affects, and I'm making it work is fine. And so I never even pursued it. And then Nate Martin out in Tooele who isn't even ABCA certified yet, writes a letter to the Senate, and boom, it's like there's no contention. The Senate passes it with no problem. I'm completely blown away.
Well, it happened in Arkansas the same way. One person, very quiet.
Quiet. That seems to be and if you can find a senator willing to represent that, then you're in.
You have to do it quietly. So actually, Nate called and asked if he could use us, and the president of the vet board from Utah called me. We had
Is that Dr. Jamie?
I believe so. We talked for about an hour and a half, and she just asked a bunch of questions, and I told her it'd be less liability on the veterinarians because ABCA certified chiropractors could get their own liability insurance, and without a referral, you wouldn't be liable, and so it would take a big, huge thing off of the veterinarian for liability. Also, ABCA certified chiropractors know what to refer, and veterinarians don't always know what to refer.
Mm-hmm.
And so she was like, okay, I'll get back to you. Well, then I never heard. And then actually Dr. Nate called because the ABCA had the written test in February, but they have not had a practical yet. The practical for those students isn't until September.
So Nate actually still isn't ABCA certified then, technically.
Correct. And so he wrote a law that he thought would take longer to pass.
Mm-hmm.
Okay? And boom, it passed. And now he still needs a referral.
Oh, the irony.
So it is what it is.
Okay.
Your video's locked up, so, but I can hear your voice excellent, so don't keep going.
Sorry about that.
That's all right.
I don't have a goofy face.
No, it's okay. We just had a case that's amazing, and it really points to this why every vet clinic should have a chiropractor on staff, or every vet clinic should have a referral available. A dog that was first seen by a veterinarian back in January for limping on the front leg, neck x-rays were actually taken. Nothing was seen by the veterinarian, and it was referred to A&M. Well, it took them they decided they wanted to do some other things first, so it took them a while. They went to A&M. They did a whole bunch of stuff, including an MRI, more x-rays, and A&M recommended amputation of the leg.
Ooh.
So they sent me the x-rays. They said, well, maybe there's a tumor that they think or something coming on, but they sent me the x-rays. I looked at the x-rays. The leg was okay. I said, well, there's no neck on here. It really would be nice to look at the neck. She said, oh, well, those were done in January. So they sent me the x-ray from January. The atlas was all out of whack. And the low neck was out of whack. And I said, oh my gosh, I wish I'd seen these in January because, and she goes, and about that time, the lady says, I know, I looked at the neck now and I see it too.
Mm-hmm.
So anyway, hopefully we're going to get this dog back, but he's got a lot of atrophy because he hasn't used that leg for, almost 6 months. So.
Mm-hmm.
But, which brings us up to, tell me about your biggest wins.
My biggest wins?
Yeah.
Do you mean
chiropractic?
in regards to, do you mean like practice management wins, or do you mean like patient improvement wins?
Either one.
And there's a lot. I mean, I've been seeing more patients now since I started my own practice than I even was before. And when the whole pandemic happened and everybody was, in the human healthcare world struggling, my husband's a chiropractor, his practice of course struggled, and I was booming because everybody was spending more time with their animals and going, oh my gosh, Fluffy is limping, or gosh, my horse doesn't feel right under me. So that was kind of fun to actually get busier with the pandemic, and it hasn't slowed down since then. But, in regards to some of my biggest wins with practice, it's all the time. it's rare when you don't have an animal that doesn't improve with chiropractic care. And there are those exceptions, and there's reasons why, and usually that's the time that you need to start involving other professionals. But it's so awesome to just see where they can go with having their spine in a line. One of my actual favorite patients that I love to tell the story of was a duck that somebody reached out to me and said, we have this family pet that's a duck, and she has stopped being able to walk. And we're not sure what to do because no vets are willing to look at her. No vets feel confident to know what to do with a duck. It's basically just recommended for us to, essentially euthanize this animal. And at this point, it's a risk to her to be non-ambulatory because she's an outdoor pet and something could come along and take her,
Mm-hmm. You bet.
And she said, and I said, well, I've never worked on a bird before. I don't have a lot of training in bird anatomy, but I can review what I can and try. And she said, well, really at this point, we've got nothing to lose because this duck is on a chopping block essentially. And so I was like, okay, great. She's like, my kids are just distraught because they love this duck. And so she brings the duck to me. Okay, so then I'm like, okay, well, how do I review bird anatomy? So I try to start looking up charts online to review where the bones are and the joints and all these things. And then I thought, you know what? I'm going to go to the store and get a rotisserie chicken. So I got a rotisserie chicken and we had a great dinner that night. And I spent a lot of time looking at how everything was put together. And when I felt that duck, first of all, lots of cervical stuff happening. And it was so cool that every adjustment I did, the duck kind of did the little like smacking it. You know how horses will lick their lips or dogs will lick their lips? Well, the duck even did a little motion with its little bill. And I'm like, wow, it's even having that release too, just like other animals do. Yeah. And I got down to its back. And as I remember, birds and ducks kind of have almost like their spine is almost a little bit fused in a way. And they have these like plates on either side that then connect to the wings. And the right like back plate thing was just, I could just tell when I put my fingers on it, I'm like, oh, this is not motioning properly at all. Something is really fixated here. And so I kind of, figured out what was happening and did a little adjustment on it, and it literally cavitated. And at first I was afraid that I'd broken this duck's bones because they have very brittle and hollow bones, as we all know. But the duck kind of just shook itself off and did the little licky thing with its bill. And I thought, well, okay. And I kind of felt the rest of it. And that was really all I found were some cervicals and then that right kind of back plate. So I gave the duck back to her and said, let me know how it's going. And she text messages me the next day and said, guess what? She can stand up again. She said she's not walking, but she is standing. And this is a huge improvement because she wasn't even able to get up on her feet for the last couple of weeks. I'm like, okay, this is great. We're seeing improvement. I said, okay, bring her back again in a few days and we'll do it again. So she brings the duck back. Same areas needed the adjustment again. I got another good cavitation on that backbone. And again, gave the duck back. A day or two later, she reaches out and says, you wouldn't believe it, it's a miracle. She's walking again. She's completely back to normal. I never saw that duck again. I never actually even talked to the lady again, but apparently the duck was fixed. And that was for me, a big testimonial to me with the power of the body to heal itself if given the opportunity. And also how cool it is that this can apply across the board to really any creature. It doesn't have to be one that we even know that much about. If you can figure out how those joints go together and how they're supposed to be, and you can find it and you can fix it, you can make some pretty big differences in their life.
Well, and we've always said that you can adjust anything and anybody can adjust. You will get results, even if you have the wrong LOCs and the wrong all that. Mm-hmm. But if you have correct LOCs, then you're better. And you obviously did. Because you looked at the chicken. So that's two things. For other animal chiropractors out there listening, we have two courses that will help on that. One is we have comparative skeletal anatomy, and we actually have 68 spines in our bone room. We have ducks. And there's two kinds of ducks. There's walking ducks and there's swimming and flying ducks. So we have a spine of each. We have chickens. We have giraffe, camel, dogs. We actually had the rare opportunity. We actually have 11 dog spines that were used by Dr. Sharon Willoughby in the original program that she taught. So
Cool.
Those were handed down and we got those. So that's awesome. So we have comparative skeletal anatomy weekend, which is all bones. And then the other one that we have for a lot of people is we have what we call food animal weekend.
Mhm.
And in food animal weekend, it looks at chiropractic from a production medicine standpoint and from an individual animal standpoint. Because there's sometimes, like, we do show sheep in the afternoon, and we might do 30 or 40 show lambs that we'll work on after we study the anatomy. So we go to the bone room, study the anatomy for about an hour or so. Then we go look at show lambs, which every joint is important, and everything. It's all about the whole thing. And then we go to a commercial ewe flock where we're looking at the importance, and it's a thing about herd impact. What's the biggest bang on the whole herd? So we make sure the ram's really moving well. Ewes, their sacrum needs to be moving good because that makes good uterine tone. Make sure the ram, the neck of all the ewes is working good. And then any lambs, we make sure that they're working, necks are working both ways so that they can suckle. And that's what we do there. So, but we do pigs, chickens, ducks, turkeys, sheep, goats, and cattle that weekend. Last year we did, I think we had 8 people. Then Dr. Amy and I, the 2 instructors, so we had 10 of us. We adjusted 368 animals.
Wow.
Between Friday noon and Sunday at 2:00. And it was all, some of it was production medicine, some of it was show animal medicine, individual medicine. So it was really a cool weekend. So they're both approved for CE by the ABCA, that like we were talking about, which is approved by the IBCA, the ABCA. So, but you do have to be certified before you can come take one of those classes. So anyway, those 2 are available. So
Awesome.
we keep going, keep promoting and animal chiropractic. We just have to. I'm amazed at the number of people, and I'm sure you've heard it when you opened your clinic. The title of the book is Yes, It's Really a Thing. Animal chiropractic, because how many, you've been doing it how many years and you still hear it, right?
Oh, definitely. I really do think there's getting to be more and more awareness about it, but still so many people that don't know. There's still a lot of people that really don't know or understand chiropractic. I think most people have heard of it now, but there's a lot of people that are very hesitant still with chiropractic in general. Although I find it really interesting that I'll have quite a few people who will bring their animals to me, but don't necessarily go to a chiropractor themselves. When you actually ask them about it, you're getting adjusted too, and they might say, no, actually, I've never been adjusted before. And you just kind of go, huh?
we probably have 2 a week that are long-term, like not long-term, but they've been in 4, 5, 6 times or more with their pet. And then they'll be like, hey doc, I got this thing, can you fix it? And of course I can't, but I refer them to a chiropractor at that point. And then they're always like, well, is he good? Is he gentle, or is he going to do what I need? And I'm like, yes. So we have, I was at a chiropractor once and I got hurt. I was at a but it's amazing what people will do for their pets. So Anyway,
That's one of the joys of this profession, I think.
yes.
You work with some really awesome animal owners. Yeah.
And it's always nice when they come to us before it's the last resort. So imagine if you were in class and getting to adjust. So you didn't get to adjust at Parker until like at the very end. I think after you graduated, they let you adjust a horse, I believe, right? I think that was the first.
Something like that. Yeah, or maybe towards the last class.
Well, we adjust all the way through class, and the students adjust, do all the adjustments on all the demo dogs and everything. And we had a dog come in, an older Springer Spaniel, and went to a woman veterinarian that was having some self-esteem problems. And anyway, so she's working on this dog, and the lady leans down and whispers in her ear, "Oh, by the way, if this doesn't work, she's going to sleep on Tuesday." So the student looked at me and said, "Are you going to fix it, Dr. Owen?" "You are." So she did. Well, they carried the dog in, the dog walked out. On Tuesday, the lady came in and she was crying. This is like 3 days later, the lady came in, she was crying. "Oh my God, I have a new dog. Thank you so much." So I said, all right. So we had to call the student, because of course the student wasn't here on Tuesday. So we called the student and had to leave a message with her, that I said, "You call her and talk to her." So she did. And the dog's 5 months later, still coming in every 2 weeks and doing great.
That's awesome.
So, what do you wish every animal owner knew about you?
Sorry, say that one more time.
What do you wish every animal owner knew about animal chiropractic?
I wish they knew that it existed. I think that's the number one thing. And I wish that they knew that it can complement anything. It can, that's the thing. It's not just for the dogs that have aches and pains. It's not just for the dog athletes. It's not just for the dog that has hip dysplasia. It can help with any animal through any stage of life, for any human through any stage of life. And so it needs to be a core part of our wellness care for all creatures, not just a treatment for when there's problems.
And I don't know about your veterinarians, but that had you, I'm sure they miss you, but did any of them use you as triage?
Oh yeah.
Yeah.
Mm-hmm.
Right.
And you mentioned that dog with the front arm limp that ended up being a neck problem. And one of my referring veterinarians, I'd say 90% of the patients I get from her are front leg lamenesses from a cervical issue.
Mm-hmm.
And she just knows it. She's just like, she looks at it and she's like, cervicals, and she knows how to palpate and feel it. And it's amazing, So, and there's so many misdiagnosed dogs too. That's another thing that is really sad. And not to put down the veterinary profession by any means. I mean, it can happen in any profession, and mistakes can happen, and they're just doing their best. But because so many of them they're missing that piece of the puzzle, the chiropractic, spinal, skeletal alignment piece of the puzzle. And there's things that are being called something else that often can be resolved with chiropractic.
Correct. And I'm glad you said that, because, believe me, I have heard, there are a few vets that are ABCA certified that are upset with the new law because, there was this chiropractor that missed this, and there was this chiropractor that missed that. And I just came back with, how many veterinarians miss all sorts of stuff? Here we had a dog that almost had its leg amputated for no reason whatsoever.
I even had just today, this afternoon, a patient who, older lab, was starting to develop urinary incontinence. really more like inappropriate urination. So urinating in the house. There wasn't really an increase in frequency, but it was just inappropriately urinating. And she was like, this just isn't my dog. And I'm concerned, and we know he was getting old and already had some issues in his spine and everything. And she also sees another vet who does physical therapy and rehab, and that's her main area of expertise. I've actually worked at that clinic as well. And when she brought it up to them, they just, kind of said, well, yeah, this is one of those age-related things that can happen, and you may need to look into getting a diaper and this and that. And the first time I saw him when this was starting to happen, I said, have you gotten a urinalysis? What if he has a UTI or a bladder infection or something? And she's like, I was kind of thinking about that too. And I'm like, she said, I've got an appointment already in a couple weeks, and it's hard to get appointments around here. So she's like, I think I'll have to check it. I'm like, okay, well, good. Well, she comes back like a day after the appointment. She's like, oh my gosh, he had a raging bladder infection. It was awful. They got him put on the antibiotics, and within 2 days, he was back to his old self. He was, not only was he appropriately urinating again, but he also was less painful, was starting to lay down normally again. There were all these other side symptoms that were resolving because they were fixing this bladder infection. And she was like, I can't believe that the vet over at the rehab place didn't think to suggest, could it be a UTI or bladder infection? And it's like, we miss things all the time. We all do. But so you've just always got to be thinking and always got to be, bouncing ideas back and forth between colleagues and trying to make sure nothing falls through the cracks. Yep.
Yeah. Yep. You got to have that referral network, and you got to be, but, the chiropractic exam and adjustment, and I know a lot of people get frustrated, come in, and they ask me if it's going to work. And I say, well, let's try it. What you got to lose? Because for 10 years before I did animal chiropractic as a veterinarian, I'd give you a bottle, a potion, or a pill and say, here, try this. Let's see what happens. And now I say, let's try this adjustment and see what happens. Give me 3 visits and we'll go from there. And it makes a huge difference. Mm-hmm. Huge difference. So, all right. Any words of wisdom or anything you would tell a chiropractor that's thinking about getting started and wondering, should they get started in animal chiropractic?
Well, I would never discourage anybody from getting involved in animal chiropractic, because I think that it's such an amazing tool to have, and to be able, for chiropractors who normally would be treating humans with these treatments. One thing, not only are you benefiting so many animals benefiting from it if you decide to offer that service, it also teaches you so much. I believe that I have become such a better human adjuster because of my experience with working with animals. You learn to feel things a little bit differently working with animals, and you learn how to kind of go with the flow in maybe some not so desirable situations sometimes. And maybe because of the fact that they can't really talk to us, and we're just trying to gather what we can from the owner's history and from what they present physically, you kind of learn how to be more intuitive to what the body is telling you. And that's one of the things too that I think is really interesting with doing animal chiropractic. As far as actual advice is concerned with that, I don't know. I say go for it, because what have you got to lose? I mean, you're only going to gain from that experience. And people are going to love it and be grateful if you've already got established, if you're already in practice and you already have an established clientele, then you've got somewhere to grow, because how many of them have animals? Probably 75% of them have animals.
Right.
And so there's always that need. There's still, animal chiropractic is such a small field at this point that there's still so much potential for all of us for growth. Yeah.
Right. Well, thank you so much. Tell me your Atlas story. Remember, you have an Atlas story.
Gosh. The Atlas story.
Yeah.
So that was because that one I remember I consulted you about a little bit. I believe it was a standard poodle, if I'm remembering correctly, that came into the office. And this was at the office with the vet who always finds me the cervical cases. with the front leg limp. And she actually is rehab certified as well. So she has a little bit more of that side of things to her, her tool belt. And the dog had gotten into a little incident at the dog park. I think had been running fast and collided with another dog, and then had been holding its head really guarded and tense and not really turning its head and things like this. So they bring it in. And of course, her being very pro chiropractic, pro alternative, she's like, oh, Allie's here today. Let me go grab her and let her palpate this. I bet he just needs an adjustment. And so, so I come in, and I think she had already done a brief exam. I don't think she had, necessarily skipped anything, but I came in and started feeling. And of course, just as you would teach us, the first area I always look at is the atlas. And so I get to the atlas and I start palpating on the atlas ala, and the right one was wiggling. And I'm going, this is a little hypermobile. Like, this is not supposed to be happening. And I'd never, ever felt anything like that before. I mean, it was almost like, oh, it kind of gave you the heebie-jeebies. And so I didn't want to alarm the owner or anything, but I was just like, I will be right back. I need to go consult with Dr. Blum over something. So I left the room and went and found the vet and said, I think we might have a fractured atlas. I believe we probably better do some imaging. And so she, of course, moved forward with that and went ahead and did the x-ray. And sure enough, the wing of the atlas was literally broken. I mean, I know you saw it too, because I sent you that x-ray, Dr. O, and it was fine. It wasn't affecting anything with the spinal cord. It was just a fractured ala. They just basically stabilized the neck, let it heal, and the dog was fine. But
then you adjusted it afterwards.
Yeah. Mm-hmm.
Right.
I do remember them coming in and doing a couple follow-ups with that. I have found broken toes before too, with dogs that are limping, and they think, oh, maybe they're out somewhere, and you start feeling around and, oh, they're very painful in their foot. Let's get that looked at, and it's either dislocated or broken. That's happened before too. So it is interesting. There's definitely things where, you have to kind of have that knowledge base, and we learned some of that in school. What are those red flags, or what are those things to look for when it's time to refer them out? And some of it comes with experience too.
You bet. All right. Well, thank you so much. I appreciate it.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.